कान का पर्दा फट जाना,
बिल्कुल,
that is real or
absolutely real, absolutely real. What that means when someone comes and tells me कि सर मेरे कान का पर्दा में hole है, छेद है, what that means is that your eardrum physically has a hole in it.
if I were to use a pin and prick the inside of my ear, I could potentially lose my hearing?
You could potentially damage your hearing. Not lose your hearing, but damage your hearing. Now, that pin would have to be long enough, first of all, to reach your eardrum, which is about 2.5 to 3 centimeters away from this opening over here.
So not that much.
Not that much at all, which is why we suggest not to use earbuds, pins, kadi, kapus. कान में नहीं डालना चाहिए. Because that can physically go inside the ear, traumatize the canal of the ear, traumatize the eardrum, cause a hole in the eardrum, and beyond that, there are minuscule microscopic bones in our inner ear, in our middle ear, which can be damaged.
ये जो earbuds वाली companies होती हैं, they prey on human beings' instinct to put something in the ear and have control of your ear,
Itching or whatever
health,
it might
whatever.
be.
But across the board, you're saying it's harmful.
Absolutely. So if you look at sorry to say, Johnson and Johnson's dabba of earbuds, they have on the outside very clearly written in capital handwriting, only for external use. So earbuds were actually made and a doctor will prescribe them to clean the outside of the ear. This.
Okay.
Not to put inside the ear.
But दिल है कि मानता नहीं.
बिल्कुल नहीं. Most people will say, I have a little bit of itching, I put it inside my ear. Now, that sensation is a great sensation when we put that in our ear. But what we're not realizing that skin in the ear is very delicate. It's not used to having something. Imagine if your skin on your hand, if every single day or every week in that exact same small location, you rubbed it. After 2-3 weeks, you'll have dry skin over there.
It would also get
skin have
inflamed.
flaking. Yes,
Yeah.
absolutely. It would flake off. Skin flaking off and sitting over there, you rubbing it even more. It's a vicious cycle. So it becomes a vicious cycle. There's inflammation in the ear, skin flaking off. So earbuds just for the outside. Now people say, how do I remove the wax in my ear? First thing I'll say is that there is a reason that there is wax in your ear. Certain amount of wax in the ear is normal. It is protective, especially in kids. More in adults where, like we said, again, dust, dirt, physical, like a mosquito going in your ear, that wax is going to stop it from getting further.
The wax is made from what exactly?
The wax is made from these glands in the skin in your ear. Just like we have sweat glands in our skin over here.
Yeah.
Similarly, we have wax glands inside the skin over here which produce this wax. Now, yes, if there is too much wax, you feel a block, you're having a complete block sensation, or there is so much wax that literally you cannot hear properly, that's when it needs to be removed or attended to.
Is your most common modality जो भी मतलब to clear wax? Is that what you get the most?
Not necessarily. I would say cold, khasi, sardi, zukham, ear block, wax, yes. That would be the most common.
What is your take on कान मेलियाज of the world? जो वो लाल वाला वो शर्ट पहन के खुद का लिक्विड लेके लंबा सा वो स्टिक लेके वो कान में वो करते हैं और वो I think they already have pre-packaged mail from somewhere that they already extract, put on their hands कि देखो निकाल दिया है. I've actually gone to one of them outside the American embassy a few years ago.
Really?
Went outside, yeah. My father and his friend. It was me and my friend. हमें को NASA जाना था, NASA वाली trip पे America. So we just come outside this embassy and these dudes were just bored. क्या करते? तो वो बैठे हुए थे पेड़ के नीचे. तो उन्होंने कहा चलो ये बंदा आ गया इससे करा लेते हैं. And they were so delighted that तुम भी कराओ. Of course I got it done. But ever since I spoke to one more ENT in Faridabad, and he's like, it's horrible.
I mean, I would say,
if you want to watch small segments of the podcast, subscribe to Toastcast Clips.
beware. Because now, this is something we have been specifically trained for. If there's wax to be removed, there are multiple ways of removing it, whether the wax is hard, soft, how deep inside the ear it is. Now, there are ways to remove these wax. Some with instruments, some like I mentioned with a pichkari in the ear of water. We've been trained to remove this wax subjectively. If you have soft wax outside of the ear, I will use my instrument to remove it. If you have hard wax, I might tell you to put some ear drops to soften that wax before taking it out. Now, those people are sort of transcending all those and just removing it with their lamba instrument. But since I have no experience with that, I would love to know what your experience was.
It feels very satisfying. Honestly, it feels very similar to an ENT doing it.
Sure. So I would say that if some of them have been doing it for 20, 30 years and they are essentially doing that 10 times a day, they might be better at that than doing it than an ENT. But now, if for some reason there is trauma, which they may not even be able to control, to the skin, you can get an infection. If there is trauma to the earbud, to the eardrum, you can get an infection, you can get a hole in the eardrum. So I would say the potential risks far outweigh the rewards.
No, of course. I meant like, जो feeling आती है ना कि there is a small rod going inside my ear and then something is being plugged out. That's there.
Very often there is nothing in your ear to remove. And they are essentially just going in there, touching the sides of the canal and coming out and saying,
What about
"Wax nikal diya."
earache? Like, is there one identifiable cause of कि मेरे को ears में दर्द हो रहा है?
So yes, very commonly I would get, you ask me what do I get complaints of, very often it's earache. Kaan mein dard hai mera. And they have no other symptom, that's it. Now earache can be caused again due to one of many reasons. First and very commonly is an infection of the outer ear. Now when I say the outer ear, I don't mean just this thing flapping over here, but the canal going to the eardrum is also part of the external ear. Very often that happens also because post-trauma. Fingernail trauma, earbud trauma. I was itching my ear while sleeping at night. That trauma where even a little cut in the ear can cause an infection. Now you might ask, but if I cut myself over here on my bicep or on my chest or on my leg, why don't I get an infection? In the ear, the skin is closely adherent to the bone below it. Whereas over here, we have lots of fat, muscle below the skin before the bone. Now, because of that, that can cause immediate inflammation, infection, and pain. That is just one reason of a earache. Another reason of a earache could be because you have a very bad cold. Very basically, that cold has traveled to the ear, blocked the ear, putting pressure on your eardrum, causing a pain. So it could be one of many reasons.
Yeah, एक चीज मेरे को, it's only after I started traveling in flights that I realized that air pressure definitely alters the way how comfortable you feel with your body, right? तो वो flight में जाके कुछ लोगों के naturally कान बंद हो जाते हैं, तो they do this, which seems to help some people. But generally, alteration of air pressure, what is the link between that and the ears?
Great question. And that movement that you just made, that's called a Valsalva movement.
Okay.
Now, like I said, at the back of the nose, there is a tiny little opening of a tube, again about 2 centimeters, which travels from the back of the nose to your middle ear. That eustachian tube is essentially responsible for equalizing the pressure in the middle ear. Equalize when I fly, when I dive, outside atmospheric pressure changes. There is no opening to that middle ear from here because our kaan ka parda is there. So the equalization, because there is normally in your middle ear, there is air. That's normal. So there's supposed to be air in your middle ear. How does that air in the middle ear equalize pressure? Through the eustachian tube, through the nose. Now, when we fly or we dive, pressure outside changes. Immediately, our middle ear has to equalize that pressure. It equalizes via those eustachian tubes. Now, you made a very specific, people when they fly, they do that. When you're diving also, you're told to do that. Why? What does that specifically do? That movement, normally those eustachian tubes at the back of the nose are collapsed. They're closed. And when we make this movement or we try to blow air towards our ears, it physically opens that eustachian tube, equalizing the pressure.